Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today's Tuesday, June 2nd, and this is my daily briefing. We've had a total of 42 cases to date in Missoula, so that number has not changed since Friday. 40 of those cases were identified by testing, and 2 were epi-linked. We've had 41 recoveries and 1 death. We no longer have an active case in isolation, and we're monitoring 1 close contact. The state of Montana has had a total of 523 cases, including 4 new cases today. Those new cases are in Gallatin, Bighorn, and Yellowstone counties. There have been 17 deaths statewide. Today I'm going to talk a little bit about what investigating an asymptomatic COVID-19 case looks like. Much of the country is starting to slowly reopen, and we may start hearing more and more about expanded testing and supplies, which allows for broader testing criteria, possibly including testing asymptomatic individuals or those people who are not experiencing or exhibiting any established COVID-related symptoms at the time of the test. During this pandemic, we've seen that an individual sometimes does test positive for COVID-19 without any viral symptoms. This means that people could have COVID-19 and potentially transmit the virus to other people without ever knowing it. Asymptomatic transmission is not uncommon with a variety of very well-known and well-studied viruses such as HIV, hepatitis C, and others. While we're still learning about the novel coronavirus in real time, we do lean on expertise, experience, and existing knowledge to guide our public health response. This includes conducting epidemiological, contact tracing, or case investigation to identify and evaluate people's exposure and risk, as well as providing health and safety recommendations like wearing a cloth face cover to reduce the chances of asymptomatic transmission and frequent hand washing in order to prevent the virus from spreading. These 2 very easy, self-directed, low-cost measures can actually go a really long way towards promoting individual and public safety, enhancing protection from acquiring and transmitting the virus. Previously, I've talked about what case contact tracing or contact investigation looks like with symptomatic cases. To date, symptomatic case contact tracing is what has been exclusively used in our county and across much of the United States, which is an artifact of having to prioritize our limited testing supplies to identify, isolate, and monitor the most number of positive cases with the resources that we had available. As you may have heard by now, at this moment, testing supplies across the United States are much more readily available due to increased production and additional federal and state funding, which allows for some expanded testing to begin across the United States. Investigating a case, any case, begins with a public health nurse speaking confidentially and privately to the patient to gather comprehensive information related to their patient demographics, their symptoms, their symptom onset, if applicable, exposure locations, and close contacts during the time that the person was most likely infectious. The infectious period looks a lot different for asymptomatic people versus asymptomatic people. Sorry, let me say that again. The infectious period looks different for symptomatic people versus asymptomatic people. When someone has symptoms, we can more easily identify the exposure window because we have something really specific that guides us. So they have a cough or a fever or shortness of breath or other symptoms. For symptomatic cases, the exposure and evaluation window is 48 hours before the symptom onset up until their date of isolation and monitoring. Determining the same window for someone who is asymptomatic or not having any symptoms is much more challenging and can be best understood as an informed estimate. We need to use our existing knowledge and experience and our evolving understanding of COVID-19 to help us identify an estimated infection window. The CDC recommends that the contact elicitation window for an asymptomatic case should start 10 days before the date when the specimen was confirmed positive in the lab. This wider time frame helps to ensure that the contact tracers identify more potential case contacts than less. We always want to err on the side of caution when it comes to health and safety. You might be wondering when a positive asymptomatic case might be able to be cleared and come out of isolation. There are 2 different routes to consider, whether someone will be tested again or if they will not be tested again. If someone is going to get tested again, they have to receive 2 negative tests in a row, at least 24 hours apart. If someone is not going to be tested again, which is often what's happening in our county and other places across the country due to the limited testing supplies, which we hope will open up and that we will be able to use the testing route to be able to clear someone, But if they're not able to get tested, the patient needs to have at least 10 days pass since their first positive test, and they need to continue not experiencing or exhibiting any symptoms since their first test. While it's unfortunate that we have recently identified another case in Missoula County, this demonstrates that COVID-19 continues to be present in our community and that we need to continue taking extra health and safety precautions to protect ourselves and others. Remember, wearing a cloth face covering while it is on your face is actually to protect others. It reduces the chances of asymptomatic spread by keeping those viral droplets closer to home and behind your mask. You're doing your friends and family a solid by wearing a face covering, especially when it's 6 feet apart, cannot be maintained. Hand washing is for you and others too. It reduces the chances of acquiring or spreading the virus. So please, let's remain vigilant but hopeful. There are a few easy self-directed things that you can do and continue doing that goes a long way towards keeping Missoula County case numbers low. Wearing a cloth face covering, washing your hands frequently, keeping your social circles small, and trying to maintain 6 foot of social distancing. Those are all really important things that we can do to protect our community and our friends and our family from COVID-19. So I just want to say thank you for doing your part in our community to help keep our cases low. And that's all I have for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website at missoula.co/cvirus for guidance or other information. And you can call 258-INFO if you're experiencing any symptoms at all, and you are a Missoula County resident or you work in Missoula County as a first responder or healthcare worker, and you can get that appointment scheduled for our drive-through testing location. You can also call that number if you just have general questions about COVID-19. You can also call that number if you have questions about flooding, because we are still seeing some flooding in our area right now. So that's it for today. Everybody stay healthy, and I'll talk to you again tomorrow.